All right. So for the next imaging modality which we'll be looking at ionizing radiation medical exposure regulation. Okay, it's not modality. This one is kind of like what rules, that have to do with you exposing a patient to what ionizing radiation. All right, we're just done looking at the what modality. So for the ionizing radiation, that's medical exposure regulation rules. They are those laws, so they are designed to protect the patient from unnecessary or unsafe exposure to ionizing radiation during medical procedures like X-rays, CT scans, or radiotherapy. That means what? Before a doctor can request maybe any of these imaging, results from you, right? It must be that what there's a need for it. Do you understand? So it just guides, because patients are vulnerable to healthcare. It's basically patients will do everything that the healthcare worker will request. So this is mainly like it will help to like guide the patient, so that at least the healthcare workers are guided, not giving some crazy rules and all of that. So they are mostly used in the United Kingdoms, and of course many countries that follow the way United Kingdoms does their things, they should be using this too. So it ensures patient safety during diagnostic and therapeutic procedures, define roles and responsibilities for healthcare professionals, promotes justification, optimization, and limitation of radiation doses. So before you are ordering for a radiation test, you know that there's what? A reason for that. Optimization is to just be what is needed. You can't tell a patient to go and be doing X-rays, CT scans when MRI, when only CT scan could have solved the issue. Do you understand? So, key duty holders is like referral request for the procedure based on clinical need. So the person requesting it for any imaging should request it based on what they need only. Practitioner justifies the exposure. Do you understand? Ensures that the benefit of the test outweighs any risks that the patient will face there. So operator is the one that now carries out the final display. Alright. So the operator is the last person that actually carries out the exposure and ensures that there's a lot of safety during the procedure. So core principles is justification, right? So exposure should be clinically requested, clinically needed. Optimization, the dose should be relative, limitation, so there's no excessive exposures and all of that. Okay, so this is just what the ionizing radiation medical exposure regulations simply means, just to ensure the safety of a patient.